Welcome to the Olive Fertility Center IVF orientation video. With this video, we hope to help you understand the process of IVF treatment. And by knowing what to expect, we hope you'll have a positive experience with your IVF treatment. Your nurse will spend time with you one-on-one and explain the details of your personalized treatment plan. Who does an IVF cycle? IVF cycles include patients who are doing IVF with a fresh or frozen embryo transfer, with comprehensive chromosome screening or CCS, pre-implantation genetic diagnosis or PGD, and those who are doing egg freezing without fertilization. What is involved in an IVF cycle? Your IVF cycle can be divided into 6 phases. These include priming. This is a treatment to prepare the ovaries. Ovarian stimulation. This involves stimulating the ovaries to grow multiple eggs at once. Egg retrieval. The eggs are extracted from her ovaries. Fertilization and embryo development. The eggs are fertilized in the lab by IVF or by ICSI and grown for up to 6 days. Embryo transfer. Embryos are transferred into the uterus fresh, biopsied, and then frozen or just frozen for later use. Embryo implantation and pregnancy. IVF priming phase. The first step in the IVF process is the priming or preparation phase. During this phase, you will take medications to prepare the ovaries for ovarian stimulation. There are several ways we can prime or prepare the ovaries for ovarian stimulation. Your doctor will decide which way is best for you. The 4 main priming treatments that we use are estrogen tablets or estrase, birth control pills, Cineral nasal spray, and androgel cream. IVF ovarian stimulation phase. During the IVF ovarian stimulation phase, injections are taken morning and night to grow multiple follicles in the ovaries. Each follicle contains 1 egg. During ovarian stimulation, the follicles grow and the eggs within them mature. We monitor growth of follicles by checking blood estrogen levels and through ultrasound to measure the follicle sizes. Once the follicle sizes reach approximately 17 millimeters, a trigger injection is given and the egg retrieval is planned. The ovarian stimulation phase starts on cycle day 2, 3, or 4 after your priming phase is complete, or on day 6 after the birth control is complete. Your doctor will create a cycle plan that is suited best to your fertility goals. Your nurse will tell you when to begin the injections, and most women will need between 10 and 12 days of stimulation injections, although some take longer for the follicles to become ready for egg retrieval. The IVF ovarian stimulation phase is a busy time as you will be taking injections between 2 and 5 times per day. We will monitor how your ovaries respond to the stimulating medications by testing your blood estrogen level and follicle growth using ultrasound. You will have to come to the clinic between 7:30 and 9 a.m. for these blood tests and ultrasounds approximately every 2 days. We will let you know when to come to the clinic by phone or through our patient portal. Medications for ovarian stimulation. Egg retrieval phase. Once your follicles are the right size and your estrogen has risen appropriately, we will plan the egg retrieval. The egg retrieval is performed at the Olive Fertility Center under intravenous sedation and local freezing. Eggs are retrieved from the follicles by using an ultrasound probe that enters the vagina. Beside the ultrasound probe, a needle is passed. The needle enters the ovaries and drains the follicle fluid, extracting the eggs. The egg retrieval procedure is mildly uncomfortable. Before the procedure, you will be given an intravenous pain medication and some freezing will be placed in the vagina to minimize your discomfort. Your egg retrieval will occur in the morning at the Olive Fertility Center, and you will be given detailed information about the procedure 2 days prior to the procedure. The egg retrieval takes 20 to 30 minutes, and afterwards we will monitor your vital signs for approximately 1 hour before you can leave the clinic. Before you leave, we will let you know how many eggs were obtained. It is normal to have light bleeding or spotting after this procedure. Extra strength Tylenol every 4 to 6 hours for the first few days following an egg retrieval is recommended if you experience pain. You must be accompanied by a responsible adult after the egg retrieval procedure because of the effects of the pain medication. You should not drive or sign any legal documents for 24 hours after the egg retrieval procedure, again because of the effects of the pain medication. Fertilization and embryo development phase. Once the eggs have been retrieved, they are now ready to be fertilized. An embryologist will check your eggs to determine which ones are mature and therefore can be fertilized. Fertilization means the successful combination of sperm and egg to make an embryo. Fertilization can be achieved in two ways: by standard IVF insemination, where eggs and sperm are placed in the incubator together overnight, or by ICSI, ICSI. In this technique, one sperm is injected into one egg in the hopes of achieving fertilization. Another option is called possible ICSI. In this case, on the day of the egg retrieval, the sperm sample is reviewed by one of our sperm specialists or andrologists. And depending on their opinion, they can decide at that point whether fertilization should occur by standard IVF or whether we should use ICSI. After fertilization occurs, embryos are grown in an incubator in our lab for up to 6 days. Day 1. The day after IVF or ICSI is performed, the embryologist will look at the eggs and determine how many have fertilized. One of the embryologists will call you with these fertilization results. Next time you will hear from our lab is day 3. The lab will assess the embryos and call you with an update. Day 5. Some embryos will develop in our incubator for as long as 5 or 6 days to become blastocysts. An embryologist will call you on day 5 and again on day 6 as appropriate to update you on the status of your embryos. Embryo transfer. Embryo transfer may involve fresh or frozen embryos. You and your doctor will decide which is best for you. Fresh embryo transfer. A fresh embryo may be transferred into your uterus on day 3 or 5 of embryo development. Embryo transfer is a simple procedure that does not require pain medication. Your doctor will discuss with you the number of embryos to transfer before you start your IVF cycle. Frozen embryo transfer. Embryos may be frozen once they have become blastocysts on day 5 or 6 of embryo development. Embryos can then be thawed and transferred into the uterus at a later date. This is called a frozen embryo transfer. For those patients doing embryo testing, either CCS or PGD, the blastocyst embryos will be biopsied and then frozen. Not all fertilized embryos will develop into blastocysts. These embryos will be discarded on day 6 of development. Preparing for your embryo transfer. When preparing for your embryo transfer, please think happy, calm, peaceful thoughts. Remember, you are one step closer to pregnancy. Some women choose to do acupuncture before and after their embryo transfer. This can be arranged on-site through the AcuBalance Wellness Center. Frozen embryo transfer. You will do a frozen embryo transfer if you have done CCS testing on your embryos, PGD testing on your embryos, or if we elected to freeze your embryos during your IVF cycle. You will need to be on oral estrogen for 13 to 15 days to thicken the lining of your uterus. You will then have an ultrasound to check that lining thickness, as well as a progesterone blood test. Once we deem your uterine lining thick enough, which is generally more than 8 millimeters, we will schedule your embryo transfer approximately 6 to 10 days later. We will tell you precisely when to start the vaginal progesterone tablets and the progesterone injections if you are taking them. You will stay on all medications for the first 10 weeks of your pregnancy. Implantation and pregnancy. You will need to stay on oral and vaginal medications and often injections right through till 10 weeks of pregnancy. 10 to 12 days after your embryo transfer, you will be asked to do a blood test for pregnancy. Please go for your blood test early in the morning so we can obtain same-day results. Your Olive nurse will phone you in the afternoon with the results, and we're all hoping they'll be positive. Many women experience bleeding during this time, and it doesn't predict whether you're going to be successfully pregnant or not. so please stay on your medications and call us if you're concerned. The time period from embryo transfer until the pregnancy test can be a very stressful time. Many women work during this time and some take that time off to rest. We offer a 1 hour of counseling to all our patients undergoing IVF and speak to your nurse to help arrange this. Having that extra support might be really helpful during this stressful time. You're pregnant, now what? When pregnancy is confirmed, it's a very exciting time. At Olive, we'll monitor you closely in the first few weeks of pregnancy to make sure things are going well. Monitoring involves typically 2 blood tests and 2 ultrasounds. At the 8-week ultrasound, if things are going well, we can help refer you to your midwife, family physician, or an obstetrician for ongoing pregnancy care. For more information about pregnancy care here in BC, click the link attached. Finance. After you have a one-on-one session with a nurse, you will then meet with a patient financial advisor. They will go through the costs of the process and answer any questions you have about the financial aspect of IVF treatment. Of course, you can reach our financial department Monday to Friday from 8 to 4 by calling 604-559-9950, extension 2200 or 2201. IVF medications. We encourage you to purchase your medications at the Olive Fertility Center pharmacy, as you will be able to purchase just the amount you need. In addition, medications typically cost less at Olive, and your local pharmacy may not stock these specialized medications. Medications can be purchased at our pharmacy 7 days a week from 8 a.m. to 3:30 p.m. Monday to Friday, and Saturday and Sundays from 8 to 2 p.m. Comprehensive chromosomal screening, or CCS. CCS testing on embryos is done to confirm a normal pattern of chromosomes in the embryo. A biopsy sample from the embryo is taken from a day 5 or day 6 blastocyst and sent to the lab for specialized testing. Your embryos are frozen after the biopsy and they remain here in our Olive lab. You may have your embryo transfer in the menstrual cycle after the egg retrieval or at some time later. The results from the CCS testing are typically back within 2 weeks and tell us whether each embryo has a normal number of chromosomes or an abnormal chromosome number. Only normal or euploid embryos are typically transferred. We transfer 1 normal embryo at a time. Please click on the link for the CCS video. Caring for yourself during IVF. Fertility Matters is a Canadian organization that supports infertility patients. They have support groups throughout British Columbia. Talk to a counselor. We include a 1-hour counseling session for patients undergoing IVF. These counselors can help you learn strategies for dealing with stress and how to manage during your IVF cycle. Complementary therapies. Many of our patients participate in acupuncture programs, yoga, and mind-body therapy. We work with AcuBalance Wellness Center, and they can be reached through their website at acubalance.ca. Journaling. Many women find it helpful to write down their thoughts in a journal. Journaling can provide perspective and reflection to help you during your journey. Nutritious diet. Eat a well-balanced diet. Remember, everything in moderation. Walking. Go for a walk. You will clear your head and get some much-needed exercise. It can help you handle stress better and get a good night's sleep. Be sure to make time for you and your partner. You're in this together, and please remain connected with friends and family who can offer you support during this challenging time. IVF is a very safe treatment, but like any medical procedure, it's not without risk. One such risk is ovarian hyperstimulation syndrome, or OHSS. OHSS is a condition in which the ovaries produce excessive hormone levels, which can cause fluid retention throughout the body. It also can cause constriction of blood flow through the blood vessels, affecting the function of the kidneys. It affects only 1% of women and is generally mild. In the severe form, however, medications and even surgery may be required to reduce the fluid that's being retained. Another complication of IVF is ovarian torsion. This is extremely rare, but it is the sudden twisting of the ovary on its own blood supply. It can cause severe pain and requires surgery to be corrected. Multiple pregnancy. At Olive, we try to transfer the fewest number of embryos that still gives you the highest possible chance of pregnancy. Transferring multiple embryos puts you at risk of a multiple pregnancy, such as twins, triplets, or even more. These multiple pregnancies are at risk for the woman and for the baby. The woman is at higher risk of developing diabetes, high blood pressure, needing a cesarean delivery, having a preterm birth, or having heavy bleeding after the birth. Complications of egg retrieval. During egg retrieval, we use a needle to enter the ovaries. This needle could potentially damage surrounding organs such as blood vessels, the bowel, or the bladder. Such complications are extremely rare. Also rare is pelvic infection after egg retrieval. Thank you for watching the IVF orientation video. We're really happy you chose Olive Fertility Center for your IVF journey. All of us at Olive will do our very best to help you achieve your dream of a successful pregnancy.